You've probably heard the term Major Depressive Disorder, or MDD, thrown around. But what does it actually mean? It's so much more than just feeling sad for a few days. So today, we're going to break down this really complex medical condition. We'll get into what it is, where it comes from, and maybe, most importantly, how it's treated.
So why is this a conversation we need to have? Well, just look at this number, 1 in 8. That's about the lifetime risk for any one of us to develop major depressive disorder. It's a condition that really touches way more lives than most of us think.
Okay, so let's get a formal definition on the table. Major depressive disorder, or MDD, is the clinical term for what we often just call depression. And here's the key thing to get. It's a medical condition. It's not just feeling down, it's a persistent low mood combined with losing interest or pleasure in things you used to love. And it's so significant that it gets in the way of your day-to-day life.
And here's something that should really make us all pause. The global impact is growing, and it's growing fast. This projection from the World Health Organization is just staggering. They expect MDD to become the single biggest cause of disease burden on the entire planet by 2030. This is not a small problem. It's a huge public health challenge.
So this raises a really important question, right? How does a feeling, something so personal, cross the line and become an actual clinical diagnosis? Well, it's not just a gut feeling from a doctor. There's a very specific, standardized checklist they use.
And that checklist comes from a book called the DSM-5. That stands for the Diagnostic and Statistical Manual of Mental Disorders. Think of it as the official guidebook that clinicians use, and for MDD, it lays out 9 key symptoms to look for.
All right, here are the 9 symptoms. Now notice those first 2 are in bold. That's because they're the core symptoms. A persistent low mood, or something called anhedonia, which is just a fancy word for that loss of pleasure we talked about. The others cover a whole range of things, from physical changes like with your sleep or weight, to psychomotor retardation, which basically means a physical slowing down of your movements and thoughts that other people can notice, all the way to these deep feelings of worthlessness.
But just having some of these symptoms isn't enough for a diagnosis. Here's the rule, and it's absolutely crucial. A person needs to have 5 or more of those 9 symptoms, and at least one of them has to be one of the 2 core ones, for at least 2 weeks straight. That clear timeline is what separates a clinical diagnosis from, just having a bad couple of days.
Okay, so we know how it's diagnosed, but where does depression actually come from? Well, the answer isn't simple. It's not one thing. It's a really complex mix of our biology and our life experiences, nature and nurture. You really have to look at 2 sides of the same coin here. On one side, you've got genetics. Studies show that about 40% of a person's risk is hereditary. But then you have the other side, environmental factors. Things like stressful life events, trauma, or even other illnesses. They all play a massive role too.
So, how do these 2 things, nature and nurture, actually work together? A really helpful way to understand this is something called the diathesis stress model. It basically says that a pre-existing vulnerability, that's the diathesis, can get switched on by a stressful event in your life.
Let's use an analogy to make this super clear. Imagine your underlying vulnerability is a cup. The size of that cup is determined by your genes and your past experiences. Some of us, just by chance, start with a smaller cup than others. Now, think of all the stress in your life as the liquid being poured into that cup. If you have a smaller cup to begin with, it just takes less liquid, less stress to make it overflow. And that moment of overflow, that's when a depressive episode can get triggered. It's a great way to see why 2 people can go through the exact same event, but have totally different reactions. And if we zoom in on the brain itself, scientists are looking at a few leading theories. You've probably heard of the monoamine theory. That's the idea of an imbalance in brain chemicals like serotonin. Other ideas focus on an overactive stress response system that just floods your body with cortisol, or even links to chronic inflammation. The science is still unfolding, but these are the main areas researchers are focused on.
All right, now for what I think is the most important part of all of this. Because understanding MDD is one thing, but knowing that it is treatable, that is everything. And the good news is, there are many effective ways to get better.
So, where does treatment start? Often, the foundation, the first pillar, is lifestyle. Now, these might seem simple, but the evidence for them is incredibly strong. Things like regular exercise, a healthier diet, and a consistent schedule can have a huge positive impact on your brain and your mood.
Pillar number 2 is psychotherapy, or what most of us just call talk therapy. This is very often one of the first things recommended, and for anyone under 18, it's actually the #1 treatment of choice.
Things like cognitive behavioral therapy, or CBT, can be super effective at teaching you how to recognize and change the negative thought patterns that keep depression going. Then, for moderate to severe depression, medication is often a key piece of the puzzle. And it's usually a step-by-step process. Doctors typically start with the most common and best-tolerated drugs, like SSRIs. If those don't work, they can move on to other types, picking the one that best fits a patient's specific symptoms.
Now, for the most severe cases, we're talking about when other treatments haven't worked at all, there's a procedure called electroconvulsive therapy, or ECT. And look, I know it has this scary reputation from old movies, but the way it's done today is completely different. It's safe, it's done under general anesthesia, and for the right person, it can be unbelievably effective.
So just how effective is it? Well, for this specific group of people with treatment-resistant depression, ECT helps about half the time. For that 50%, it can be genuinely life-saving.
But, and this is a really important but, it's not always a permanent cure. The data also shows that about half of the people who get better with ECT will have a relapse within a year. It's a powerful reminder that managing depression is often an ongoing process.
So, who is most likely to be on this journey? The numbers are pretty clear. MDD is diagnosed in women almost twice as often as it is in men. And while we don't know the exact reasons why, it's probably a mix of hormones, genetics, and social factors. We're also seeing a really worrying trend of it becoming more and more common in younger people.
And to put all of this into perspective, it's kind of wild to think that our whole modern way of looking at this is really new. The actual term Major Depressive Disorder only came about in the 1970s. It didn't become an official diagnosis until the 80s. So in just a few decades, we've gone from a fuzzy concept to a defined illness that's about to become a major global crisis.
So if you take just one thing away from all of this, please let it be this. Major depressive disorder is not a character flaw. It is not a personal weakness. It is a defined, it is an understood, and most importantly, it is a treatable medical illness. There is hope, and there are many, many different paths to getting better.
And that leaves us with a final and pretty heavy question to think about. Knowing everything we know, especially the fact that depression is hitting younger and younger people, what is the single most important change we can make as a society to support them? It's something we really all need to be thinking about.